Welcome to the CodeCast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hi, everyone, and welcome to the CodeCast Podcast today. We are at episode 36, and today our topic is going to be HIPAA and texting. So the Health Insurance Portability and Accountability Act, we know that's all about privacy and making sure you're embracing the challenges that come with confidentiality, integrity, and availability of PHI, which is the private health information, and just making sure that we're doing what we're supposed to do when it comes to complying with HIPAA. But before we dive into today's topic, the CodeCast Podcast is brought to you by Advanced MD, spotlighting telemedicine as a solution that's proven to boost patient engagement and bring in new revenue streams for your practice. AdvancedMD.com. And Healthcare Executive. Healthcare Executive Network is the fastest growing community for healthcare executives and their trusted partners. HealthcareExecutivesNetwork.org. So as we focus on HIPAA today, I'm going to focus on the texting portion of that privacy rule and really just kind of pull apart what that means, because there's different avenues and deliveries when it comes to the word texting. So we want to take a look at that. I'm aware of email and voicemail also plays a role when it comes to HIPAA and just some of the rules there. But in recent years, a great number of medical practices have really embraced text messaging as a popular means of communicating to both patients and their internal staff members. So it's how you get a hold of doctors as well. But despite the convenience and time-saving benefits, healthcare providers and staff must be aware of potential consequences when texting electronic protected health information. So we're going to call that ePHI. Text messaging includes any communication service or application that enables the transmission of electronic written messages between two or more mobile devices. So this could include the short message service, which is the SMS, text messaging, and other service providers. So iMessage, WhatsApp, anything like that. So there's all kinds of different apps for that as well. So there are some challenges because under HIPAA, healthcare providers must maintain the confidentiality and integrity and availability, all ePHI created. So the ePHI, again, is the protected health information. I just want to make sure my acronyms are getting across. But all that's created, received, maintained, or transmitted by a covered entity. So providers have to have that confidentiality. Unfortunately, text messaging presents multiple threats for meeting some of those requirements. And some of those threats include standard SMS messages are not encrypted. And so that can be a problem. The sender does not have the ability to control if and when the message is discarded upon viewing. And then the biggest one for me is no clear path to verify the reader's identity, which opens the door to unintended recipients. And that would be otherwise known as your HIPAA breach. And remember, or think about this. So let's say that you're just texting somebody just between your friends or whatever. And all of a sudden you get into a texting conversation or a group message between people, and you have several different texts on your phone. So just think about this. This happens to me every once in a while. It's like, oh boy, I can't believe that happened. So obviously not with, patient health information, but just from a personal perspective. So I have a group text that maybe it's my book club. We got 9 people on there. And then I've got a text between maybe my 2 brothers and I. And then I've got a text between a friend of mine and maybe my daughter is on another text. Well, sometimes everybody wants to text you all at once. And you respond back because sometimes your phone will kind of put you back into the text that you need to answer from one that just came in, not the one you were working on. And so you send a text to somebody going, oh, shoot, that wasn't for them. And so, especially when you're trying to yell at your brother to somebody else, not saying I did that or anything, but you're trying to say something to somebody that you don't want them to hear. And it's unfortunate because they end up getting it and then you have to backtrack. So when it comes to patient health information and protected information, this is, not just a mistake or an oops. It's more of this breach in that patient's, confidentiality for their healthcare. And so even well-intended providers who find ways to implement and oversee texting, security measures must also think about, really this documentation. Any exchange between providers regarding a patient's condition must also also make its way into the patient's medical record. So it can't also just be part of that text message. So unless the provider integrates text messaging with their electronic medical record, which I have not seen that yet, it can be difficult to ensure appropriate documentation. Also, you never know if that entire text is going to get there. And I don't know about you, because I'm going to actually give Apple a hard time here. I have the iPhone. I know a lot of you have Androids or iPhones or smartphones or whatever. And it drives me insane, because even though I do like a lot of features of it, and I feel like I'm kind of stuck with it because I have also an iPad, and there's just so much integrated information now. They kind of get you with that. I really miss my BlackBerry, believe me. But now what happens is that the spell check on there, and I've turned off the spell check and it doesn't make anything better. But I've tried to do something just to put in electronic health record, for example, and it changes it to her. Or I've tried to put in a female name, which will be nameless, and it changes it to a profanity name. I've never once used that name in a profane way. I would never do that over texting. At least I try not to. But basically, it's just interesting to me because it'll put words in there. For a perfect example, my husband's name's Tom, and every time I type his name in there, it puts in ATOM small letters, Atom. And I'm like, what the heck is that? So it's just interesting when you see what, the smartphones that aren't really that smart do, and that documentation, you just can't assure that it's appropriate and getting into the right spot. Now, we want to know what HIPAA says about all this. So unfortunately, the HIPAA laws and Office for Civil Rights, the OCR, they do not have anything specific outlining regarding texting requirements, and all of the forms of communication present some level of risk, and it really is the healthcare provider's responsibility to ensure privacy and security while data is being exchanged. So despite the lack of HIPAA specifications regarding texting, providers should keep in mind a general adherence to the HIPAA privacy and security rules. So both have objectives and controls for navigating the secure sending of electronic protected health information. So HIPAA privacy rule limits provider disclosure of electronic patient health information or protected only to authorized individuals or entities. And the HIPAA security rule, so there's two rules, and some people only look at the privacy rule, but the HIPAA security rule requires that providers protect patient-sensitive data from any threat to access or disclose PHI, that's patient information, health information, to unauthorized individuals or entities, and should a breach or unauthorized disclosure occur, they have an immediate remediation plan. So what are you going to do to fix it? So best practices, and I've mentioned that kind of term before. Best practices really refers to what a practice does when they are doing things correctly. So I get practices all the time saying, Terry, what's best practices? What have you seen in the country, since you travel all over the country and you have clients everywhere, as you all have heard on also through my Coding Corner on demand coding questions. The questions come from everywhere in the country and now out of country. What is it that you think that we should do in best practices? So despite the risks, a provider can take steps to reduce the likelihood of a breach of HIPAA violation while utilizing text messages. But when texting any sensitive ePHI information that might be locally stored in a device, encryption should be applied in the event of a loss, disposal, or theft. Additionally, the text might be stored at the server level, so the phone carrier, or remember the cloud. I remember my brother just told me this week, he said, it's not because there's anything on there I didn't want my sister-in-law Linda to see. She went on a trip for the summer. He said, and without them, and without him anyway. And he just said, I sent her with my iPad, but I had to clean it out first because I had information there, because he's a realtor, on clients and things like that. He says that I just didn't want to travel. So he says, you just never know what's going to happen on the cloud. And so, or the phone carrier. So the following safeguards can help protect PHI, protected health information, with establishing compliant communication. So this is what I would do. Security risk analysis, that's called SRA. So while conducting an SRA, a healthcare provider will identify where ePHI is created, received, maintained, and transmitted. So for text, electronic protected health information will primarily be created, received, and maintained on mobile phones. Okay, so now you have to think about that. Limit PHI. So whenever possible, it's best to text with limited or no health information. So included in the message. Example, appointments confirmations, instructions to call the office to receive test results, etc. The reason that you really want to limit it, I've seen a couple practices that have just, and to me it's interesting because we always think the lazy way out means that the practices are doing something to cut back their work, to make it easier for them and, kind of get around things. And I'm seeing with texting and using that method to deliver information to patients, practices are going overboard so that, the patients don't have to call in. They're trying to avoid them calling in like it's, a nuisance for them. And so what I see in some practices is they'll say, I actually saw this and it was frightening. Your biopsy came back positive and we need to see you to schedule a mastectomy. That is absolutely in breach of HIPAA. You can't put that on a text message. So from the HIPAA text, it isn't, but it is a breach of HIPAA information. Remember, there's a difference because we just don't have the rules and regulations with regard to texting specifically, but we do have it when it comes to specific disclosure of information, and you don't know who that authorized individual or who the clear reader's identity is and who's opening that message. So that's where that's just an absolute no. Don't do that. Limit your PHI, your protected health information against a text. Policies and procedures. So ensure texting is included in the policies and procedures, specifically administrative and technical policies. So it's important to outline what is acceptable to text along with an outline of steps. Should a text be sent to the wrong patient or incorrect recipient? So when you're training in your office, and I think I mentioned this maybe last week on simple mistakes that were being made or the week before, just make sure that you're really training people on what to do if you're going to allow it. Make sure that there are policies and procedures on what's appropriate, again, in case the wrong patient or incorrect recipient gets a hold of that text. Workforce training. So a well-trained workforce is any healthcare provider's best defense against undisclosed PHI exposure. So workforce training should include the sharing of information, securing authorized devices, and using secured third-party apps that might permit sharing information, again, in a secure way. Make sure you're looking for that information and that they are not just an app you find haphazardly on your smartphone, but it is an application that maybe becomes on a list. American Medical Association, OSHA, HIPAA, they do have some of those lists that'll tell you what's appropriate. And then waivers and intake forms. So ensure all patients' forms are up to date with the current HIPAA requirements. The form should plainly state which methods the patient allows the provider to contact them. And so make sure that the patients have a say in it. Additionally, forms should be included who outside the patient can receive their information and what can be sent. For example, I have an adult age daughter, and it never fails. Now, we dealt with this in college. As soon as they turn 18, our kids, even though we still want them to be ours, nobody wants to talk to us, not about their grades, not about even money. I said, well, I'm fitting the bill for some of this. And they're like, it doesn't matter. She's 18 or she's this age. So think about it when you've got a 22, 23-year-old daughter and she goes to the doctor and you're trying to get a result on something. They just won't give it to you unless you have something that authorizes them to let you in. So make sure that those forms do include who outside the patient can receive their information, what can be sent, and if texting is okay, if they're okay with that. Some of the Medicare age patients are not okay with that. So be clear on that. And plus the other thing is too, I notice that sometimes when patients are allowed to text, that's all they'll do. They won't call the office. They won't set up an appointment online if that's how your practice does it. They do it all through texting. And then they just assume that you're going to do it instead of actually call the practice. So be aware that it can also be a crutch for a patient as well. And the notice of privacy practice. So a notice of privacy should be standard operating procedure for providers and distributed to all patients. So if the provider has included text messaging as part of their communication model, ensure the notice of privacy includes texting. So put that within that texting. And then also, when you're having these conversations with patients, when we talked about, who can do it, what can be sent, also who can send it. So not just, what can be sent, but who is allowed to text somebody and who is allowed to say something. I don't think I would want a receptionist pulling up a path report on the computer and texting the results to a patient. It needs to be a clinical person within your office and then limited on what protected health information goes out. Your administration staff or your coding and billing and front office professionals, they are more for, please call our office for an appointment, or missing an insurance claim form or something to that effect, or we need a copy of your new Medicare card, but know who can also text and what their limited ability is to send the text over. So we just want to make sure that you really got this information. It's becoming such a problem lately. And so I wanted to focus on that. I'm going to also at some point, not for a while, but I'm going to probably in the next couple weeks, do something with email and voicemail, mainly because I also get a lot of my auditing records through email and they just have to be protected. So, and you need to also know where HIPAA falls for the BAA, which is the Business Associate Agreement as well. But also just in kind of finishing this little topic here, what about conversations? Make sure your free conversations are also behind closed doors. You're not going out to lunch with your staff and talking about patient health information that's protected. So make sure your front desk has some kind of a barrier where their conversations about other patients can't be heard. And if patients need to have a conversation about something going on with them, that there is a private area. Otherwise, you really can just get in trouble. Patients are finding all kinds of reasons to, sue nowadays. So we got to be careful with that. Okay, so our coding question for the week, and actually I wanted to put in our last sponsor today, our final sponsor. We're coming back to Women in Healthcare UK. Women in Healthcare is a community for healthcare professionals aiming to provide a platform for women within the healthcare sector. Since 2001, England, United Kingdom. It's kind of exciting when you see that we have not only sponsors from every part of the country, but all over the world. And everybody's really getting into podcasting as far as listening now. So we really appreciate that. And I got a really sweet message from somebody the other day, and I just wanted to give her a shout out. I just really like it when I get these really nice messages from people. And she was just so nice. And I just really wanted to just tell her, and her name is Stephanie, and she contacted me through LinkedIn, and she just really thanked me for the podcast. She listens to them every day when she's driving for radiation treatments, and she's dealing with that. And she's also taking some final exams for her coding job and trying to get certified. So I just want to shout out to her and just let her know that we're thinking about her and we're really excited for her and her recovery, and we can't wait to see her as a remote coder. So I appreciate those comments, and it's really nice when you guys reach out and I hear some of those things, and those are really inspiring things to hear. So we have a question today. When coding a chart for an evaluation and management E&M service, how do we know where the current condition symptoms and the past condition symptoms fit into the code choice? Okay, this is from an Illinois person. So I can't believe I put an S on the end of that. And the answer is chief complaint, history of present illness, the HPI, and the review of systems are all parts of the E&M code that include notations about current conditions or symptoms the patient has that you're coming in for. The past family and or social history, the PHISH they call it, PFSH, part of the E&M code describes any conditions the patient has experienced in the past that might be related to the current condition or symptoms. So that's where you find the difference between that. So just know your current is your chief complaint, your HPI, your review of systems, and then your past conditions, that fits into the code as far as your past family social history. And then our last shout out, I do want to give to my music producer. He's Johnson Dasassin Music, DASASIN Music.com. He has a new album out, and so we want to make sure that we acknowledge him, and hopefully it's called Meet My In-Laws, and it'll be out on July 13th. So we hope you support him, and you can find it on iTunes and all streaming platforms. So we're excited for him with his third studio album. Okay, so we are going to go ahead and call it a day, and we look forward to seeing you on the next, having you on the next CodeCast podcast. So everyone, make it a great day, and we'll talk to you next time on the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at terrycoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.